So let's talk a minute about folic acid deficiency. Folic acid, if you remember, folic acid's added to lots of different foods. Folic acid, we've learned over the years, is important because a pregnant mother needs folic acid because that will help form the neural tube, so a neurological formation. It helps that work properly in the embryo growth. So folic acid is very important for pregnant mothers. So folic acid could be caused by malabsorption syndromes. It could be caused by poor nutrition, alcohol abuse, people that aren't eating correctly. Hemodialysis patients, folic acid is removed during hemodialysis. Normal folic acid serum level is 3 to 25. So it's similar to B12, cobalamin, or B12 deficiency, but you don't have that neuro issue symptom of tingling and paresthesia in your extremities. So two things look similar, symptoms are similar, signs and symptoms, nausea, anorexia, but the one thing is the neuro. You don't have the paresthesia and weakness with folic acid deficiency. Oral replacement therapy, it's very simple. There's a lot of people just taking folic acid replacement tablet every day. Some people say it's good, some people don't know. Okay, we have other chronic disease anemias, things that are causing anemia. It's not really just one thing, but it's going to contribute to anemia. For example, patients that have renal failure are usually low in blood. If they're in renal failure and getting hemodialysis will destroy red blood cells in your hemoglobin, so you would be anemic. You may not be making enough erythropoetin. If you're not making enough, you're not going to have enough red blood cells. Erythropoetin is what the body makes to stimulate more red blood cells. So if you're not making enough, you don't have enough. HIV, hepatitis, malaria patients, all of these patients, chronic diseases, it causes low anemia for these patients, low hematocrit and hemoglobin. Patients that get patients that have dialysis, these patients pretty much after every dialysis, because it does destroy RBCs, will receive a sub-Q shot of epogen. Epogen is synthetic erythropoetin. It's given sub-Q, and these patients get one right after dialysis. So let's talk about aplastic anemia. Aplastic anemia is a decrease of all blood cell types. This also is a congenital problem. 70% they say are idiopathic. Idiopathic means they're not really sure why it happened, but it just does. It could also be brought on by radiation, chemical agent exposure, things like that. Hepatitis can cause this one. So anemia, fatigue, and dyspnea. That's the common symptom through all anemias. You're just tired. So if you have an aplastic anemia, they don't know why it's happening, then this is where they're going to do a bone marrow study. So somebody with aplastic anemia, if it's going to decrease all the cells, unless they can find out why and fix that, if they know, they have very poor outcomes because you're now got a decrease of every cell that you have. These patients could have a stem cell transplant to try to rejuvenate the bone marrow. It may work for some, may not work for others. So acute blood loss. Acute blood loss is you're bleeding out. You're losing red blood cells and hemoglobin. If you bleed out too much, as well as losing your blood, you're going to become hypovolemic. So this type of anemia, you're either going to lose too much blood that you become hypovolemic and you pass out, eventually die if you don't stop the blood. So we need to stop the bleeding obviously give them blood replacement if it's warranted, and also give IV fluids. If somebody is hypovolemic, you don't want them to lose their blood pressure, and the lower the blood pressure goes, then oxygen will not make it to the organs that need it. So IV fluid replacement is going to be isotonic, and blood replacement as well. Identify the blood source and get it stopped. Okay, so there's a hemolytic type of anemia. These are destruction of RBCs. They're not working as well. So sickle cell anemia is a type of hemolytic anemia. Sickle cell anemia is autosomal. Basically what happens, it's going to change the abnormal form of the hemoglobin. It goes into a sickle shape, elongates the erythrocytes, so the hemoglobin cannot attach on these sickle cells. It's predominantly African American clients. It's exacerbated by low oxygen levels. So somebody who has sickle cell anemia should not be climbing high mountain peaks because low oxygen levels up there. Not a good thing. So the problem with sickle cell anemia is these sickle cells, when they try to pass through the capillaries, they get they clog up. They like back up on the highway, and they cause occlusions. This will make it so cells can't get through. Those tissues cannot get oxygen. It's very painful. So these patients are in lots of pain. So it's an exacerbation of low oxygen. If they're also low in fluid in their intravascular system, that will also cause that. So these cells that are sickle, they circulate through the spleen. The spleen says they're wrong, they're not made right, I need to destroy them. So that's going to cause the anemia, is they basically get destroyed cells through the spleen. So signs and symptoms of sickle cell, it varies from person to person. It could be a chronic issue for some people. Sometimes it's an acute. But what ends up happening is their extremities, capillaries, they don't get enough oxygen. They turn pale, bluish in color, and it's very painful. When these patients have a sickle cell crisis, meaning it's actually clogging up, then these patients need lots of morphine. You don't give them Tylenol, you use opioids, and they need oxygenation, and they also need IV fluids, so it'll try to unclog that. So after a long period of time, though, you can imagine if your cells are being clogged all different places, then it's also going to be clogged in your brain, your kidneys, and lungs. So over a period of time, there could be damage. So these patients need to stay hydrated, make sure they have enough oxygen, don't climb mountains, but very painful for those patients that have the sickle cell crisis. So management of that, alleviate the symptoms, fluids to reduce the viscosity, pain control. If they're in the hospital with an acute crisis, perhaps on a PCA, a lot of education. If you're not allowed to do certain activities because of sickle cell, then depression may be an issue. There's a lot of depression with any chronic illness that you have. Here's a picture of your sickle cells right there, normal cells, and here are your sickle cells. They're not going to be able to hold the oxygen. They clog up the capillaries.